YouTube land, Facebook land. Welcome. This is the GIMS American Academy production. Assalamu alaikum. Good evening. This is Mr. Justin Tyler, your parent relations executive here at GIMS American Academy Qatar. Have a special show for everyone today. Very excited as we wrap up Breast Cancer Awareness Month. I have some of my friends with me here from GIMS American Academy and a special guest from KIMS Medical Center in Wakra, and also they have a branch in Barwa City. So we're going to introduce soon Mrs. Jagjit Kaur, Dr. Jagjit Kaur. But before we get to the introductions, let me go through the live stream. So this is our second live stream, right? We had one in September, and that focused on like COVID and parenting strategies. So for the month of October, now we're focused on, more so of the breast cancer awareness, because this is the theme of that month, okay? So we're here today to, discuss that and to have our panelists share a little bit of their personal stories, their experiences, and actually their profession and what they do to help with awareness and prevention, all right? So today I'm going to have everyone kind of introduce themselves, right? Because you don't want to hear from me, you want to hear from them, right? So we're going to have them introduce themselves one by one before we get into the presentation from Dr. Kaur from KIMS Medical Center, all right? So first and foremost, let's introduce Dr. Jagjit Kaur. She's a specialist for obstetric and gynecology at KIMS Medical Center. So Dr. Kaur, can you introduce yourself and tell us who you are?
Hello everyone, this is Dr. Jagjit from KIMS Medical Center. I am a specialist of obstetric and gynecology, working here since last 4 years. And today I'll be presenting you with the breast cancer facts, awareness, and when to go to the doctor. This is the gist of my presentation.
All right. Thank you so much, Dr. Jagjit. We'll be coming back to you soon. We're going to introduce everyone else before we begin, okay? So the next person I want to introduce you to is one of my, colleagues here at the school. She's a hard worker. I love the way that she does what she does as a teacher here. And she's also a breast cancer survivor. So I really want you to give a warm reception to Miss Areti. Miss Areti, I can't pronounce your last name. I don't want to butcher it, but I'm gonna let you talk for yourself. All right.
Yeah, so I'm Miss Areti. My last name, which you do not need to know, is Papa Vasiliou, Greek. So don't worry about it. So I am the support teachers for grade 2 and 3. It's my 5th year in GEMS, and I am a breast cancer survivor. I was diagnosed in 2016. Yes. And I'm gonna share my story with you.
Yes. Thank you, Miss Areti. Appreciate that. All right. So the next person also is special to me as well. She's a superstar student at our school. Really can't say too much more positive about her. I mean, she really does a lot in our school in terms of students and leadership. So now we're going to have Miss Kayla Longland discuss who she is, introduce herself.
Hello everyone, my name is Kayla Longland, and I am the student organizer for the breast cancer awareness event in our school. And I was in charge of raising awareness throughout our school and raising money for charity.
All right. Thank you so much. Thank you so much. All right. And I guess I'll introduce myself if you want to know that. So I'm Mr. Justin Tyler. I'm the parent relations executive, or, I direct a lot of the parent relations, marketing, communications, PR for the school. And I'm working in conjunction with my co-host, Miss Deanna. And so, Miss Deanna, I want you to introduce yourself and who you are, and let us know about your status here at the school.
Hello, I'm Deanna. I have one student in GEMS, Saman in 9th grade, and then I am the Parent Association representative, president, and I'm glad we have these every month, different topics. And so this month we're bringing breast cancer awareness.
Yep. Thank you so much, Miss Deanna. She's my faithful co-host, the parent extraordinaire. She has like 8 arms. She does everything. She gets everything done. I don't know how she's everywhere all in one place. All right. So I'm going to put some information in the comments here. for our parents on Facebook and also YouTube. So we definitely want to get your comments throughout the show on Facebook, and also, your questions also on Facebook and YouTube. So please feel free to put your questions in the comments or the chat section. We'll be able to answer them at some point throughout the show. So we're going to have Dr. Jagjit talk and do the presentation. We'll have a Q&A with her after she's done. And then we'll have another Q&A after we hear from Ms. Areti and also from Ms. Kayla Longland, okay? So we'll have 2 different Q&As. So flood the comments, flood the chat with questions and comments. Let us know how we're doing, okay? So first thing first, in the chat, just let me know if you can hear me, all right? I just want to see if you can hear me. My video is good. Let me know in that comment section and chat if that's the case, okay? All right, so we're going to move forward, and now it's the time for the presentation from Dr. Kaur. She's going to really talk about breast cancer awareness, break down some facts versus some myths, and then also go into, what is, breast cancer? How do you know? How can you detect it? She's going to go into all these different things. So now it's a time that I'm going to give the presentation floor to her. So Dr. Jagjit, it's now up to you now to do the presentation.
Hello, everyone. This is Dr. Jagjit. I'm starting with my presentation. Since October is the month for breast cancer awareness internationally, so this is my topic for today. I am working as a specialist gynecologist in the KIMS Health since last 4 years. Though breast cancer is a topic for surgeons, but it's a female organ. Many patients come to me for their queries and examination. So I'll start with, what is breast cancer? It's a group of cancer cells that forms a lump in the breast, and that is a malignant tumor. This is breast cancer. Mostly diagnosed in women, and in rare cases, it can be found in men as well. Breast
Dr.
cancer
Jagjit,
facts.
so
Yes,
before
please.
you go ahead, we can't see the presentation. So if you could share that on the screen, or if you want me to, I can share it from my end if that's better for you.
You can't see the presentation?
No. Mm-mm. And so while we wait for the presentation to come up, just make sure you leave your comments and questions in the Facebook comment section or the YouTube chat. I'm not sure exactly where you're looking from or viewing the show from, but you can definitely flood our comments and chats with any questions, comments, feedbacks, concerns. We'll make sure to address them at some point during the show. And then also, too, as a way to pay your tuition for the show, like the video.
Is it visible now? Excuse me.
Subscribe. No, I can't see it now. Do you want me to pull up the presentation? Yeah, I can do that if you want me to. I can pull up the presentation.
They cannot see. We share the screen, but they cannot see. We'll ask for our technical assistance.
Know what I can do? I could pull it up myself, okay? I could pull it up myself. No worries. Let me share my screen. Give me 1 second, everyone. Thank you for your patience. All right.
So they cannot see it.
Let me see. Okay. So let me see if this works. So Dr. Jagjit, can you see the screen now?
Actually, I'm seeing my presentation only.
So I can move it for you, okay? If you want me to go ahead, I can move the slides for you, okay? So
okay.
All right. Yeah, no problem.
So I start again.
Yeah, if you like. Yeah, go ahead. You could be fresh.
Yeah.
Start again.
Breast cancer is a cluster of malignant cells that develops as a lump in the breast. This is known as breast cancer. Mostly diagnosed in women, and in rare cases can be found in men as well.
All right. So go to the next slide.
Breast cancer facts. It's commonest cancer in the women. 1 out of 10 women have breast cancer, And the tumor has various stages. In stage 1, it is localized to a small area in the breast. In stage 2, you can feel some lymph nodes enlarged in the axilla. In stage 3, the tumor grows in size and gets irregular. And in stage 4, the lymph nodes in the other axilla or elsewhere in the body can be found enlarged. This is known as stage 4.
All right.
Next is the risk factors. So gender, female gender is commonly affected, but males do get it, but very rarely. And in the latest studies, they have found that in Gulf section, more men, like incidence of men getting breast cancer is rather more than what is there internationally. Age group. It is there in age group of 50 plus. So screening in US, UK is done in the 50 plus females, but here in Gulf area, we start here at after the age of 40. It's more common in white or African American race. And it's been found lately that inherent gene mutation is there. The normal gene BRCA1 and BRCA2 are there in everyone, but there is mutation sometimes that can lead to cancer. Family history, if the first degree relative of any female has been diagnosed as breast cancer, having breast cancer, they should be very cautious and do the routine screening at rather early age. Alcohol consumption is another factor. If it is consumed beyond limits, then it can lead to breast cancer. So if there is any history of radiation to the chest for any tumor or any other problem in the childhood or young age, it can also be one reason for breast cancer. If breast tissue is dense, then also chances of breast cancer are more. But if it gets in a thin, small breast, then the spread is very fast because the local tissue is very less. Obesity, it's the curse nowadays, and it can lead to so many problems like diabetes, hypertension, heart disease, and cancer is also one of them. Early menstruation before the age of 12 years has been found a risk factor, and not having children or children late in life, that is also another risk factor. Late menopause after the age of 55 is another risk factor, and using post-menopausal hormone replacement therapy, that is also a risk factor that can lead to breast cancer. And excessive use of oral contraceptive, what I mean, it's not to be used over long period without a break, that can also lead to breast cancer. And high level of estrogens in the body due to estrogen treatment or various syndromes, it can also be a reason for getting breast cancer later in life. Now I come over to the symptoms. So how breast cancer can present itself. There can be a lump in the breast that is different from the rest of the breast tissue, and it was not there before. There can be a rash on the nipple. There can be abnormal discharge from the nipple. Breast can become swollen, or there can be pain in the breast. There can be prominent veins over the breast. The skin of the breast can get puckered or retracted, and there can be dimpling of the skin because of the tumor pulling the skin inwards. There can be thinning of the skin over the tumor, and even there can be ulceration, that some discharge can be there. Or nipple can get retracted inwards, and there can be like change in the size of breast. One breast becomes abnormally bigger than the other. So why disparity in the size of the breast? These can be the common symptoms, but all these symptoms can occur otherwise also. So don't get scared and don't decide by yourself. Whenever you have any of these symptoms, just see the doctor. Now I'll talk about, there are so many myths because of this social media, and too many problems are coming and patients are getting scared, and everybody thinks that, oh, I'm going to get it, I might be the 10th woman. So one by one, I'll talk about the myth. So myth one, if I don't have a family history of breast cancer, I won't get it. And the fact is, most people diagnosed with breast cancer have no known family history. Myth two, if you maintain a healthy weight, exercise regularly, eat healthy, limit alcohol, you don't have to worry about breast cancer. Although these behaviors help lower breast cancer risk, they can't eliminate it. Next myth is breast cancer only happens to middle-aged and older women. This is more common in women aged 50 or above, but young age is no excuse, because gene mutation can occur in young age, and if there is a family history, they are more likely to get. So this myth has to be broken. Next myth is wearing a bra can cause breast cancer. So over the centuries, women have been wearing bra, but incidence of cancer is not that much as all women wearing bra. So there is no direct or indirect correlation of wearing a bra with the cancer. Next myth is using underarm antiperspirants can lead to breast cancer. So there is no direct connection between antiperspirants and breast cancer, but safety of antiperspirants is still being studied. Next myth is carrying your cell phone in your bra or in your breast pocket can cause breast cancer. Of course, everybody is aware that phones do give radiation, but there is no direct connection between cell phones and breast cancer. But safety of cell phones is still being studied. Next myth is consuming too much sugar causes breast cancer. There is no direct connection or correlation that consuming too much sugar in the diet causes breast cancer, but sugar is a culprit for many diseases. As I stated earlier, diabetes and heart disease, liver disease, and high cholesterol. So these act as comorbidities, and when patient is having all these problems, the chances of cancer in the body increases, and cancer cells do feed on. They are rapidly dividing. They need a lot of sugar. So, but there is exactly no direct connection between the sugar intake and the cancer. Next myth is annual mammogram guarantees that breast cancer will be found early. Although mammography is early detection tool and is the best one, it doesn't always find breast cancer at an early stage. Next myth is breast cancer always causes a lump you can feel. So I told you earlier also that all lumps are not cancers, and breast cancer may not form lump in the early stage, especially when it first develops. Next myth is early stage breast cancer rarely reoccur. You must be knowing, or for your information, I tell most of the cancers we just look for 5-year survival rate. So even with early stage breast cancer, we cannot say that it will never return. That depends on the patient and other modalities of treatment, how good the patient is going to survive with the treatment. Next myth is all breast cancer is treated pretty much the same way. No. Now a wide variety of treatment options are available, and that depends on the type of cancer and the patient preferences and choices. So these were the common myths, and I have told you about all the facts. So next I come to the prevention, which is the aim for this awareness campaign. So everybody should have an early detection plan. If breast cancer is detected early, there is 100% 5-year survival rate. So early detection plan includes monthly self breast examination and regular clinical breast examination, complete body checkup, and mammograms depending on your age and health and family history. So first I'll talk about how to do self breast examination. So you should stand in front of a mirror with your arms relaxed by your side and look for changes in shape and size of the breast and color of the nipple, or if nipple has changed direction or has been retracted inwards. Next step is place your hands on the hips tightly and bend forwards and backwards and see that both the breasts move same way and free movement is there, or any part of the breast if it is not moving, just check that it can be a problem in your breast. Third is standing with one hand behind your head, and with the second hand start feeling from your axilla and slowly coming towards the center of the breast and try to look for any lump or abnormal swelling in your breast. And next step is palpate with your fingertips together, feel your breast tissue from up to down and down to up, and then in a circular motion coming from outside to the center, ending at the nipple. And last step is just press your nipple and look for if any discharge is there. So purpose of screening is early detection and prompt treatment. So for screening, breast self-examination. If you find anything, then clinical breast examination, which can be done by any healthcare professional, be it a nurse, be it a midwife, or a obstetrician, or a general surgeon. And then next is in the screening, ultrasound breast or mammogram. Mammogram is X-ray, and ultrasound breast, that is also nowadays very much advanced. So ultrasound breast also can be opted as a mode for screening any lump in the breast. And this is general advice for staying healthy, that healthy diet, you should have more fruits and vegetables, use whole grains, no processed food, limit the amount of alcohol, exercise regularly, maintain healthy weight. So now I'll come to the breast health plan. It is different for the normal females and females at risk. For normal females below the age of 40 years, they should go for clinical breast examination every 1 to 3 years. And women at risk, they need to do a clinical breast examination by a healthcare professional once or twice a year. At women more than 40 years old, they should do yearly clinical breast examination and mammography if advised. For the women at risk, they should go for annual mammogram and breast MRI as and when advised. So breast cancer prevention. I repeat, maintaining a healthy weight, staying physically active, eating fresh fruits and vegetables, no smoking or to the minimum, and alcohol consumption in the limits. This is the most important point, when to see a doctor. So number one, if you have a lump in your breast and lump feels firm or fixed, one thing. Second, lump persists beyond 4 to 6 weeks. Number three, if there is redness, dimpling of the skin or puckering of the skin, and a discharge, and which is usually blood from your nipple, or there is shape change in the nipple if it is retracted inwards, and then if you feel some enlarging lymph nodes in your armpit, so then don't stay back and look for treatment options by yourself. It is the time you should go to the doctor and do as and what is required from you by the doctor. Thank you.
Dr. Jagjit, thank you so much for that presentation. I was sitting back like a student and learning myself, a lot of these things. So now that we have the presentation finished, I'm sure there's some questions for you, Dr. Jagjit. We won't keep you too long. We know that you're working at this time. So what I'll do is pull in some of the questions on the screen so you can see them, okay?
Yes.
So the first question here is, how do men screen for breast cancer?
Excuse me, I couldn't hear you. Can you repeat the question, please?
Yes, the question's on the screen as well, Dr. Jagjit, as well. So how do men screen for breast cancer? Is it different from women?
No. It is for men, the screening is like if they feel some abnormality, like as I told, the increase in the size of breast, or they feel some lymph nodes or anything, they should preferably see a surgeon, because breast is a subject of surgeon, so they should see a surgeon, and then surgeon will do the physical examination, and then he will advise for this breast ultrasound or mammogram, or if need be, then there can be a biopsy also. But these are the further steps. First thing is that screening for men in general, it is not required. Its screening is for women only. But if they feel, men feel some abnormality is there, they are feeling uncomfortable, or they feel some difference, they should always see a doctor. But screening is recommended mainly for females, because it's a common disease of female. Men it's a rare.
Yes. All right. So I have another question for you that I have for you. This question is, I don't know if it's showing on the screen. Do you see it on the screen? So hold on one second.
I see the first one.
Yeah, let me move this first one. Let me move that out the way. And then I'll bring the second question up in a second. So here's the question here. So you'll see it on the bottom of the screen. So can I plan for a baby while having breast cancer? Not me, but can a woman?
I can understand. Of course, it's not you. Actually, it's if you are having like you are a diagnosed case of cancer, it's not the right time to plan for a baby, because that patient will be undergoing various treatment modalities, and they are not healthy, because chemotherapy, radiotherapy, or surgery, it's not the right time to plan a baby. She can plan it later when she gets cured, or she's out of the treatment session temporarily, like some chemotherapy sessions they repeat after 6 months or later. So that time she can plan, but this is not the right time to plan, because cancer is more important to treat than having a baby.
Okay, that's good to know. Good to know. I have two more questions for you, okay, Dr. Jagjit? Two more questions.
Yes.
Here's another question that I have here, and I'll hide this one here. Can a mother with breast cancer breastfeed her baby?
Actually, the breast cancer is always, most of the times it's in the one breast. So if she is a breastfeeding mother, she can feed from the other breast. No need to feed from the cancer side. She can just extract the milk and discard it, and from the healthy side, she can continue feeding her baby, unless she is on some chemotherapy sessions. That is not the time, because many drugs get excreted in the milk, so that is not the right time. If she's not on chemotherapy, she can continue feeding her baby, but from the healthy side.
Okay, it's good to know as well. And I'll have one more question from the comments here as well. From Miss Tinsey, we'll bring her question up. She said, at what age do women with first degree relative diagnosed with cancer should start the screening?
As early as 25 years, not before that.
Okay.
Unless they have symptom. For first degree relatives, the screening, which includes self breast examination and clinical breast examination, it should be started not before 25 years. After 25 years, it can be started. And like in some countries, it is told that after 35 years, if she is asymptomatic.
Okay. Do you have time for one more quick question? This is a very quick question.
Yes,
if you have
please.
time. Yes, just one more. And I think it's an interesting question. What about eating soy products? Does that influence any type of cancer in someone?
See, soy products that has vitamin K2. Mm-hmm. So that is a very healthy vitamin for general women health. So soy is that way considered healthy because the Japanese women, I have heard, they take more soy products and they are healthiest of the women. So soy products I myself take, and they are healthy option. Depends if they are not genetically engineered or processed. So soy products, they can be taken.
Very interesting. Okay, that's good to know. Doctor, do you have anything that you want to share with the audience before you leave today?
Yeah, like I hope they like my talk, and for any queries, they can just come and visit me. I am available in a split shift in KIMS Health Center, and I will just say, take care, ladies. It's your time, and just give yourself a priority, and don't. Family is a priority, but you yourself a priority. So take time for yourself, and give yourself like good quality time, and stay healthy, stay fit. Thank you very much.
All right. Doctor, we know you have to go. You had a lot of patients, I'm sure, waiting for you. Thank you so much for coming on here today. I received a lot of information. I know that the panelists did, and I know our audience did as well. I'm going to talk a little bit more about KIMS Health now, and let them know about what offers that you've given them as a kindness of your health medical center. But come back and join us another time, Dr. Kaur. I would love to have you back.
Sure. Most welcome. Most welcome. Thank you.
Thank you so much. Have a good day.
Okay.
All right. Wow, that was great, right? That was a lot of information there. And I learned a lot actually from that presentation as well. So as a kindness of KIMS Qatar Medical Center, they are giving our staff and also our parents discounts if they want to come to their medical center. So I told them that I would definitely show these discounts. So let me take that off the screen and then put on the discounts on the screen. And so they have these fancy like cards, these called privilege cards, right? I don't know if you can see them right there, right? Privilege card, right? So I have these in my office. I have a whole bunch. If you're interested, parents can come see me. Staff can come see me directly. I'll give them directly to you. Or if you're parents on this live stream, have your child come into my office. I'll give them the privilege card as well. And once you go to KIMS Qatar Medical Center, they have one in Wakra. They have another one in Barwa City. All you have to do is say, I'm from GAAQ American Academy, and they'll honor this privilege card for you, okay? So once again, come to my office if you're a parent or if you're a student or staff, and I'll make sure you get one of these privilege cards. So you can see that there's 50% discount on consultations, another 25% on laboratory visits, another 25% on radiology appointments, and another 10% on just procedures, general procedures that they have at their medical center, okay? So that's really cool for them to, give us that, offer, that promotion. And then for you to contact them, I'll put this on the screen as well. This is their information in Wakra, right? And so phone numbers, and then also the email address. And then I'll put the other one here as well. So this is the one in Barwa City, okay? Barwa City, all right? So cool. I think that's pretty cool. Now we're going to move on to the next scheduled guest. And if you see me looking up, I have a big old screen right in front of me, okay? That's why you see me looking up, all right? So we have another guest here, and I'm really excited for her to talk about, her story, okay? If you haven't heard her before when she introduced herself, she is a breast cancer survivor. And I, found that out last year when we talked, and, it was something interesting to know that you have one on your staff and that could share a personal story. And I really appreciate her coming on today and taking some time to also share that story with the whole entire community. So Ms. Areti, the floor is yours. We want to hear from you. I'm listening, all right? I just want to hear from you, and then I'll have some questions for you after you're finished.
Thank you.
Okay?
Thank you.
No worries.
So let me first start by saying that I had no family history, like none, at least from the relatives up to that we know had ever breast cancer or ovarian cancer. But because I'm a very stressful person and because I believe that when science gives you the opportunity to prevent some things, you need to use that. So I was getting, like, every year I would go to my doctor, my gynecologist, to get tested, and I would, like, every month, every 2 months, I would have a self-exam. So it was like a routine. So I was 36 years old when I found it, a lump. Tried to stay calm, but it's not me. I freaked out. So I went to see a doctor. They sent me for, I had like mammogram and ultrasound, and they said I need to have a biopsy done. So when we found out it was cancer, I had the surgery, and after the biopsy, and that they had more information. So then I had to do the rest of the treatment, which was chemotherapy, about 6 months, and then radiotherapy, I see. And because I was so young, they wanted me to have a genetics test done, even though I had no known history. Turns out that I am BRCA1 mutation positive. So I do have the genetic mutation. Apparently it's in the family, obviously. It's just that it never actually showed up to anyone except me. So in this case, there are some prophylactic measures you can take. So like prophylactic mastectomy and hysterectomy. And because when you have that mutation, your chances of breast cancer is like 75%, and for ovarian cancer is about 50%. So I that's the way I went. I chose that, so I'm safe, and I feel safe. And now it's my 5th year cancer-free. It's been going well so far. It was very hard at the beginning, tough, but as time goes by, things get easier. But it's always on my mind. I'm not gonna lie. It's something that's always on my mind, and it's still scary. Like every time I have to go do my my tests, it's, even if it's just blood test, there's always a fear.
So, Miss Areti, I have a question for you as well. Like, you said that this was in your family, like there was a mutation that was found in your family. Did anyone before you have it, like mom or aunt? Nothing.
Well, they didn't have the cancer, but obviously the mutation is in the family, and it's actually about my dad's side. But because all these are percentages, so like they were on the percentage that did not show the cancer, I got the percentage that did show.
I see. And I would say, like, you never know the strength of someone until they go through something. Some of us look really strong, and some of us don't look that strong, but it's all about the inner strength, right? The inner will, to carry on. So I always thought that was fascinating. Some of the biggest people are sometimes not the, most, strong people as well, right? So it's very interesting. Now, I have another question for you in terms of, like, what was your biggest self-discovery or revelation after you were diagnosed?
I stopped worrying about many things. I was worried, I was stressed about everything in my life, or what was happening. And after that whole thing, the only thing I could think of is that as long as I'm healthy, I can make everything work. So that for me, and I know we say that a lot, that you need to be healthy, everything else, but until something happens to you, you don't really realize it. And that it was the same with me. It's just that after that, I'm like, as long as I'm healthy, like that's one, then everything else can work out somehow.
Okay. So, bonus question for me as well. Like, who was your support system? You can't get through it alone. You know what I mean? So
yeah.
who was there for you?
Family and friends, obviously, and because I'm here. My family's back in Greece.
Yep.
So they weren't physically here with me, but they were there for me. And my mom flew all the way here because my son was really young, was like 5 years old, to help. And I had friends here that would go with me during chemo and radiation, just to have a company. So, and that's like, it's friends that I consider family now. They're not just friends.
Of course. I don't want to hog all the spotlight because I can ask you questions all day about this. Deanna and Kayla, do you have any questions for Ms. Areti about her experience?
I do. How did your family respond when they first heard that you got cancer?
Sorry?
How did your family respond?
Well, be honest, I wasn't able to tell my parents because I was crying the whole time. So my sister-in-law was with me, and she was the one that told them. Everybody was really upset, and then they tried to look really strong in front of me because it's not helping when you see the other people getting emotional as well. It was hard for everyone. And I can see in my parents now that they see me a little bit differently. They're more worried about me now than before. And I'm like 42, but still.
Definitely.
Yeah.
Definitely.
I'm also, my mom had cancer. And so I was only in middle school when she first got breast cancer. I know for me as a child, it was very hard to hear that your parent has cancer. And then she got it 10 years later again, and on the other side, breast cancer. So we thought we were going to lose her, but thanks God, she's still around with us.
Yes. Shout out to your mom. Your mom is great. Shout out to your mom. All right. So Kayla, do you have any questions for Mr. Areti before I go on with mine?
No, I don't have any questions, but thank you for sharing that. It really is great hearing your story, and I pray for your future and your health and everything.
Thank you.
Very nice. Very strong. So a couple more questions for you as well. So what's the one thing you wish you knew before you started treatment?
That it would also because they tell you about how hard it will be physically. They tell you about the hair and the nails and everything. They don't really emphasize the psychological part, which is really hard because you need to be super careful. You cannot really go out. I was wearing masks, so because my immune system was so low, I was trying not to get sick or anything. But nobody said how hard it would be psychologically. I knew everything about the body part, but it was hard as well.
So I have to imagine this too, because there's other questions that are coming to my head. So during COVID and all of that, and also being a survivor, right? So what precautions were you taking during that time?
Nothing really special because I'm not anymore I don't know how it's called exactly. So my immune system is okay, and I'm not in therapy. If I were in therapy, that would be a problem. Right. So I was wearing the mask, and I was lucky because they have a very good system here. So they actually called me. I was one of the first ones to get the vaccine, the COVID vaccine, as high risk. Literally the second week they started, I had my dose. So they're good this way here.
Okay.
I have a question. Did you continue working when you were going through treatments?
No, I couldn't. Even if I wanted to, because it made me very sick. And also was depressed. So I don't think that would be a good combination to be a teacher. So I wasn't working. I started after chemo finished. That's when I started, because radiation is easy, doesn't bring you down or anything. It's chemo, it's the hard part.
Okay. I have one more question for you. All right. I know I gave you more than I thought I would give you. You just gave me such good content. I just gave you a lot more. This one is what advice would you give to someone to best support them through breast cancer if you heard one of your family members or friends had it?
let them feel what they're feeling. I know everyone, the first thing is, don't worry, everything will go well, but no, that's not the case. Like, it's something serious. You're seriously sick, and you need to validate that you need to go through the crying and everything. Like, you need to do that. You cannot, and this one thing, like, do not say, because it's really annoying to hear them, everything will be okay, everything will be okay, and no need to worry, because it's not. That's the thing, it's not. So just let them feel what they have to, like, they have to go through that. They have to go through the fear and everything, and it's okay. It's okay to do that, because that's what you need.
Okay.
I have one more question for you.
Okay.
I have,
yeah. So Deanna,
yes,
after you go, hold on. After you go, then I have one more from the audience as well.
Okay. I don't know if in Qatar they ring the bell when you finish with your treatments. If they do, how did you feel whenever you found out that was the end of your treatments?
They didn't. I don't know if they do anything when you, because I will be officially discharged when it's like 5 years from the treatment. I don't know if they do anything then. It wasn't anything for, like, just finish the treatment. So I don't know. I'll let you know.
Let us know, and we'll ring a bell. You know, let us know. We'll ring the bell. I'll make a bell. I'll bring a bell in here. Don't worry about that. Somebody gonna ring a bell for you. You know what I mean? So good question, Deanna, on that one. We have one more from the audience. I'm gonna show that. Hi, my name is Rifna. Hey, Rifna. I joined the session late. Don't know if you mentioned about your treatment. If not, where did you go through the treatment?
So I had the first surgery, so the lump removed in Greece, because it was like holiday season, so I just happened to be there. And then I had chemo, radiation, and then the prophylactic hysterectomy and everything. I had it here in Qatar.
Awesome. Hope that answered your question, Rifna. Thank you for showing up. You know, even if you're late, you're still on time. All right. So appreciate that. I don't have any other questions so far, but do you have any closing statements, right, for anyone about breast cancer awareness as we are closing out the month?
It's what I said at the beginning. When science gives us the tools to prevent something, because it will happen to you if it is to happen, but if you can get it early, and the science gives us this opportunity to get it early, like, do it. Like, do the self-exam. It's nothing. Go to your doctor, and if you feel something, of course, don't freak out, but, like, go check it. Don't just leave it saying, I'm young, it's nothing. Like, I'm the example of that. Unfortunately, I learned about, because when you have it, you hear, of course, many others way younger than me, and that was even scarier. So it's rare, but it happens.
What's the youngest you've heard age-wise?
23.
23. Okay. Oh, all right.
And the problem there is that you don't think it's something like that, because, like, it's 23. Even when I went with my mammography, and they said, like, it's a cyst, you're so young. Like, everybody was sure.
Yeah. Interesting. This has been enlightening. I really appreciate you coming on today. I really appreciate you, not only as a panelist, but as a colleague. I really appreciate you. You're welcome to stay on if you like.
I will, of course.
You know, yeah, I know your son may want you. You know, I hear him in the background, I think, a little bit.
It's fine. He just came home. Sorry.
No worries. No worries. All right, so stay on with us, Mr. Areti. Before we go into the next segment with our student, Miss Deanna, you had a...
Yes, can I jump in? One question more. You said they told you it was a cyst before they diagnosed it was breast cancer. How long did it take between being diagnosed?
It was really fast, because, like, in the mammography, they can see there is a lump, but they cannot tell what it is. And cyst is something very common, especially to younger women. And then they do that was the same moment that they do the ultrasound, where they can see if it's a cyst or something else. But you still don't know, because it might not be a cyst, but it might be still something benign. and that's when they do the biopsy. And I found out the same day later on.
That's pretty fast. That's good.
Yes.
Yeah. Yes.
I think they rushed it because of my age. So they rushed it a little bit.
Okay. All right. Well, thank you for sharing again. We're going to move on for the sake of time. But before we do that, just want to make sure people can, know to leave your comments and questions in Facebook and also YouTube. If we see some coming in, we're going to show these comments at the end of the show, at the conclusion of the show, and at the Q&A session for Miss Kayla now, since we're moving forward to her discussion. And so the other one I would say is like the video, leave a comment, subscribe to our channel. Doesn't hurt, not asking you for any money. Just press that like button. That'll help me out. That'll make me smile. All right. Thank you so much for being here. All right. So we're going to move on to Kayla. So Kayla is a student organizer of the breast cancer awareness. She's a born leader in our school. She's a grade 12 student here. So I'm not going to do too much of her glow up. She can talk about herself and kind of what she does in terms of her leadership here. And I have a couple of questions I want to ask her at the conclusion of her discussion. So Kayla, can you go ahead and talk to us about what you do for breast cancer awareness and what you did with the students this year?
Okay, so I was in student council for 3 years. Here we did a breast cancer awareness event, and we started off small, but it was like we would always improve as the years went by. And this year, there wasn't yet a student council. Miss Ali, she asked me if I want to take lead in this event, and I was like, yeah, sure, because I know so much about it and I'm passionate about this event. So I was in charge of Pink Week and raising money and spreading awareness this year. So the first step that I did was I got in contact with Qatar Cancer Society. I sent them an email and I was like, we're doing our annual fundraiser, and are they able to send us any products that we can sell? So they were able to send us t-shirts, ribbons, and hats. So once we got those in, I made posters promoting it around school, the prices of the things we were going to be selling, and just spreading awareness, letting everyone know that it's coming up and that there's also Dress Down Day. So once I created the posters, a week or so after, it was Saturday, and me and Miss Ali, we invited a few volunteers over to school, and we decorated the school. So we had pink balloon arches, we had posters, and we just had decorations. So when everyone would come back on Sunday, they would know that it is Pink Week. So after that, for 2 weeks, we were selling before school, and after school we were selling the hats, the ribbons, and the t-shirts, and we're just getting donations from anyone who are willing to donate to us. And on Thursday and Wednesday, people were able to wear pink, and that's when our sales went up, because people are like, oh wow, this is Pink Day. So they were buying ribbons, they were donating. People were simply just donating money. They weren't even purchasing items. And that was really, it was so good to see people actually care about this. And by the end of the event, we counted the money and we were able to raise 6,583 riyal. So we doubled from the previous year. And the first year we did it, we got 1,000, and then 3,000, and this year we had 6,000. So awesome. We're so thankful that people actually care, and the improvements were so great, because it's not about the amount. Every small bit matters, but it was great seeing everyone donate. And during this break, me and the student council president, we went to Qatar Cancer Society and we dropped off the money, and they were so thankful. And yeah, I'm just so happy we're able to make a difference.
You can check out that picture on our Instagram page if you want to see Kayla and Ibrahim donate the money to Qatar Cancer Society. All right. So shameless plug for our Instagram. All right. Kayla, so I have a couple of questions for you. You answered one of them very well, so I'm not going to ask that one. But this one here, I wanted to get your opinion. So how do you get everyone to care? Because you had said that it's hard to get people to care about it. So how did you do that?
Breast cancer awareness, it's really our first major event of the year because it's in October, and everyone looks forward to it now because we've been doing it for like 4 years now. It's our 4th year. So they were really like excited because it's like one of the first dress downs. It's the student council, they were selling snacks. So the kids are very excited about that. And as well as they were selling snacks, we're doing the fundraiser. And that's how we got people to care about it and letting them know that this is for charity, it's for a good cause. We're so thankful in this country, people really care about charity, and they're really kind, they have a great hearts, and they're able to donate a lot of money and support these causes. So that's how we're able for everyone to like care about the event and the initiative.
So I have a bonus 1A question.
Okay.
How is it being a leader? Right? Is it a lonely job? Is it tough, difficult? How are dealing with people? Because we always ask that question, but until you're a leader, you don't know how difficult it is. So how was your experience with that?
It is difficult, but at the same time, Miss Ali, she makes it like easy. Like I go to her after school every day. I'm always talking to her. I'm so thankful. Like she's the one that like she creates these like initiatives for me, and she gives me really good opportunities. And she sees the hard work I put in, and that's really it's a good feeling that seeing people recognize your hard work and the effort. And being a leader, it's a great feeling because you're able to be a role model for others. And my friends, they're all proud of me, my family. Like it's a great feeling knowing people like recognize your hard work. And
yes. Definitely. Just wanted to hear from you. I know it's not an easy job. Definitely. Another question I have for you is more about your preference, right? Do you have a breast cancer awareness story that like deeply impacted you, or maybe a statistic or some type of other visual that impacted you?
Well, the other day I was in the car with my dad, and I was just like telling him like what I was doing in school, like this event. And I also told him the money we raised, and he's like, wow, that's good. And I was like, yeah. He's like, like in our family, like there's history of breast cancer. And I didn't really know that. He's like, I'm so proud of you for like, doing this, like without even like having really a personal connection, because I didn't really know. And he's like, we're so proud of you. Like we're, yeah. And I was like it's really like eye-opening knowing that it's in my family history, and this whole event, this whole meeting, this Zoom has also made me more aware, and it's making me like making me prepared for my future, and knowing that I'm going to have to go through these scans and all these kind of stuff. So yeah, I'm very grateful for this event that we are doing this year.
Yeah, definitely. And I'm impacted by it too in some ways, because I had a family member who had a breast cancer scare. She was very nervous about it. Had to go get a checkup. I don't know if they did MRI or something. I don't know. It was something. I think it was MRI, but she had to sit in this thing for like an hour, get the body scanned, everything like that. Got some blood treatment, everything. But found out that it wasn't breast cancer. So that was good news to hear. But it does impact everyone, I believe. I think everyone has a story of either a near miss or actual breast cancer. So something to think about. But I just wanted to get your opinion on that as well, because you're young, right? So I don't know if it impacted you in some way or not. We're much older, so we have more things that will impact us a little bit, All right. So Kayla, what would you want to say to everyone before we move on to the next part of the show? Anything you want to share with anyone?
Just always be aware of all the kinds of medical issues anyone can face. Like Miss Areti said, like trust the tools that we have today. Like go follow the science. It's there for a reason. Also make sure that your loved ones know you're there for them. This can happen to anyone, and going through this alone would not be ideal. So always supporting your family and your friends and anyone that's going through any kind of tribulations in life.
So Areti and Deanna, do you have any questions for Kayla before we go for it?
I have one. Actually, it's, I just thought of it. How do the kids your age react to like breast cancer awareness? Because it's not usually something that is in a teenager's mind.
I know. Yeah, that is true. I'm not really sure. Like, they didn't really talk about that. But I guess, like, no one really, like, said anything to me about, like, that. I guess they all know about it because, obviously, it's a very, like, big deal. And we're having these events every year because of how big of an issue this is. And we want to spread as much awareness as possible. No one said anything negative. They were all just supportive and happy that we're able to raise money for charity.
Yeah, it's amazing.
I think Kayla said it really well said. All they hit all the points. Yeah.
She does that sometimes. And shout out to Miss Ali as well. She's always doing things that motivates the students, even if they're not comfortable with the leadership aspect of it or know how to go about everything. She's always like a constant source and a rock, for the kids. So I really appreciate her as well. All right. We're almost at the end of the show. I want to cut a little bit short because I look at the time and I'm seeing it ticking and ticking and ticking, which is great, right? We have a lot of things to say, but I want to be able to make sure that we close it out. So the thing that I usually do at this part of the show is really talk about any families that are interested in admissions. We are a school, obviously. We do host this every single month in collaboration with our parent association. But we do have an admissions process. We do admit students. We still have space available in our school. And so if you're interested at any length about our school, the American curriculum, you can contact, the reception _AAQ at gymsedu.com. Those are my closest colleagues here. They're the ones that are front lines of answering any questions that any parents would have. And if you want to set up a tour or a virtual meeting, you'll speak with me. And we'll really flesh out all of the questions, that I can give you all the answers and hopefully go on a tour. And, hopefully you'll see that this is a school home for you. If not, I still was happy to see you as well. All right. So if you want to call, if you're, want to more talk to someone, these are the two numbers that we have here at our front desk. And to also see our lovely website, which we redesigned. I think it's, one of the best in the country. You can check it out, GAA_Qatar.com, and it's GIMS American Academy, right? If you're looking at what the acronym is, GIMS American Academy, okay? Kayla, you're a student. What do you think about our school before we move forward to end the show? What do you think about it?
You're always putting me on the spot.
That's what I do. So I'm here for, to put everyone on the spot.
Yes, I love this school. I've been here it's my 6th year. I've been here since grade 6. This school, it has so many great opportunities. Like I'm able to do this fundraiser because of the opportunities that are available to us. The teachers are great. They're always there for us. The facilities at our school are great. Our school is beautiful. The students, everyone, it's just a great community. Like the sense of community in our school is something that's very rare. And I'm so thankful for everything the school has provided for me.
We're thankful as well. Definitely appreciate those kind words. I always put you on the spot. You know that. So, so at this point of the show, before we end, I always go through some of the comments that go through the Facebook and that go through the YouTube chat. And so I'm going to display some of these here because we're really thankful for all the people that showed up today. So Mr. Ali Kutsi, no problem. Thank you for the opportunity. Happy to have you here as well. I think he was responding to me saying good afternoon or something to him. So we really appreciate that, Mr. Kutsi. We'll go down to some other questions. Some of the ones I've already displayed as well. So Rifna's Kitchen, there we go. Hi, hello. Let's go to her other comment. She said, thank you so much for sharing. And then we appreciate you being here as well. The next comment here from Miss Miashka. She said, so much amazing advice and information. Thank you all so much for sharing and speaking about it. We appreciate you as well for showing up. Oh, wow. I have a childhood friend here in the chat. So this guy right here, I've known him since I was in 6th grade, right? So I guess maybe even earlier than that. So thanks for showing up, Mr. Harrison. Such an amazing school. Thanks. This was very helpful. Appreciate it. And then Miss Miaska one more time. And this is our admissions secretary. She said one of the best schools in Qatar. I think she would say this even if we weren't admissions secretary at the school. But thank you for showing up as well. That is it, everyone. So we survived, right? We are here at 6:10. So 5 minutes before I thought we would be finished. All I want to say to everyone is thank you for the panelists that are here today. Thank you for my co-host, Miss Deanna. She's always here every single month, and she is the representative of our GAAQ Parent Association. So really appreciate her being here as well. And thank you to all the viewers in YouTube land and Facebook land for actually showing up today, checking them out. Even if you didn't say anything, in the comments, we still appreciate you as well. And then we're going to be here next month, inshallah. We'll be here for a special one next month about personal finance, family budgeting. So with your money, how are you budgeting your money? What is assets? What's liabilities? What's your net worth? What about halal investments? Right? We're going to go through all of these different things next month to help our families become better in the financial aspect of their household. Okay, so I'm really looking forward to that one. And I think, inshallah, that'll be Tuesday, November 30th. And we'll do it at 5:15 so we could pay respects to Maghrib prayer. So we'll do it at 5:15 next month, inshallah. All right, so that's a little sneak preview for that. And then I will be in January. I'll tell you what I'm doing later on, but I'll be hosting a live stream in January. And we'll talk about that a little bit more. All right. Thank you so much, everyone, for being here. Like Ms. Shahida said, go Raptors. We got to end on that note. All right. Have a good night, everyone.
Right. Thank you. Bye.
Bye-bye.
Assalamu alaikum.